This podcast series is made possible thanks to the generous support of the Patient Care Foundation. The Patient Care Foundation supports medical students in need through scholarships. Each year, the Patient Care Foundation changes lives forever by giving deserving medical students facing incredible odds funds to continue their education, resources as they deal with food, housing, and transportation insecurities, or other challenges in the wake of COVID-19. Thanks to Dr. Troy Elander, Chairman of the Patient Care Foundation Board, and Elizabeth Kurihara, Board Member. This year's virtual event is April 16th. To register and donate, visit patientcarefoundation.org. Once again, visit patientcarefoundation.org. Welcome to this edition of Clear as Mud, the podcast dedicated to bringing clarity to medicine. I'm your host for this episode, Gustavo Friedrichsen. Our first podcast featured Dr. Cesar Chavarria, as he shared how the pandemic nearly destroyed him and his livelihood. As we surpassed the one-year mark since the 35-year-old man presented to an urgent care clinic in Washington state, which the CDC later confirmed as a COVID-19 case. As of this podcast recording, there have been 1.1 million cases in Los Angeles County and nearly 20,000 deaths. Latinx have the highest death rates per 100,000, with 288 compared to African Americans at 160, Asian Americans at 123, and whites at 100 per 100,000. Dr. David Hayes Bautista is a distinguished professor of medicine and the director of Center for the Study of Latino Health and Culture at the David Geffen School of Medicine at UCLA. Dr. Bautista was a LACMA guest on a recent Race Against Time Zoom with over 100 physicians to share his insights on how the pandemic has decimated Latinx communities. Dr. Bautista is joined today by Dr. Hector Flores, LACMA Executive Committee and Board Member and Medical Director for the Center for Hispanic Health at Adventist Health White Memorial and Co-Director of the Adventist Health White Memorial Family Medicine Residency Program. He co-founded and serves as Medical Director of Family Care Specialist Medical Group and has more than 25 years of experience in medical education. Dr. Bautista, Dr. Flores, welcome to Clear as Mud.
Thank you. It's a pleasure.
Thank you, Gustavo.
Thank you both. So, Dr. Bautista, can you summarize what you recently shared with physicians relative to the pandemic and its disastrous impact on the Latinx community, particularly here in LA? And Hector, love to get your perspective as well, but let's start with that in a couple of minutes, if you don't mind.
We've completed 12 reports out of my center on COVID and the Latino population in California. And unfortunately, we have watched with dismay as month after month after month, the number of cases, the number of deaths, the case rate, the mortality rate have climbed. Most recent data as of 27th of January for age 50 to 64, prime working age adults, the Latino death rate is 6 times higher than the non-Hispanic white. And these are folks who are working hard to keep the state fed and moving. That means we're losing part of our labor force that we need to keep the state moving ahead.
Hector, your thoughts?
And I would add that it is the perfect storm for the community because, as David mentioned, and he mentioned this in his earlier presentation, the Latinx community is overrepresented among essential workers. And typically, they're in very small employer organizations, which are organizations that want to do the right thing, but they don't have the resources or the wherewithal to actually provide a safe working environment, not only for their workers, but for their clients. And many times workers get infected in these jobs, like agriculture, food preparation, construction, et cetera. And then they take that disease home. And because of their living circumstances, they tend to be very low income, so they can't afford housing. So they end up sometimes combining 2 or 3 families in the same location, which means it's just a setup for a rapid super spreading event, which is the innocent worker bringing that disease home. So that's some of the issues that we're going to need to find ways to mitigate.
And Dr. Bautista talked about the perfect storm taking 170 years to develop. My question is there an imperfect solution, or is it going to take decades of hard work and commitment and creating a pipeline for physician leadership, creating a pipeline for hospital administrative leadership, and working within the communities? You all have been facing this for generations. Hector, you've been in the trenches as a provider, as a physician, as a caregiver for many years, and David as a researcher, as an academic, but also as a writer, author, and a voice for the Latino community. You know, I'm looking at the two of you right now in real time and thinking, I mean, what would be the imperfect solution to this going forward?
Well,
David?
probably the quickest thing we could do is, in fact, invest in the voice of leadership, of Latino leadership in the healthcare industry, of leadership for the multicultural, multiracial population of the state of California. That we could do fairly quickly because these issues have taken 170 years to develop. That's been 170 years of neglect of the Latino community, basically by the formal institutions of healthcare in this state. They won't be fixed in 5 months or even in 5 years, but with leadership giving vision, giving direction, we can create the agenda to eventually close those gaps.
I agree. And this is an area where there's a great partnership between Latino health professionals, academic institutions like David's Center for the Study of Latino Health and Culture, and the LA County Medical Association. And I think that that's a perfect opportunity for us to build on what David talked about, the leadership development, and the importance of the support to those leaders so that they can get different actions to respond to our community. I would say and ensure that we're getting the infection prevention and control strategies to help our community while we're all waiting for the vaccine. But then secondly, to speak out on the vaccine equity, making sure that there's an equitable distribution to the most affected communities. And thirdly is to really keep our eye on the economic stimulus that the Biden-Harris administration is proposing, because that is a potential lifeblood to help our communities recover.
Are you both optimistic that we have one of your own, Javier Becerra, right? I mean, Javier is from California, obviously, and you both have great knowledge of him and his experience and background. Are you optimistic that he holds the highest position in the land when it comes to healthcare delivery and policy and carrying out those executive orders by the president, by the administration? Are you optimistic about having the Secretary Becerra in that role today?
Well, once the confirmation step has passed, I certainly have every confidence in him. I've known him for the longest time, ever since he was just beginning his career. And while he was the Attorney General of the state of California, you actually have had a chance to see him tested under fire. And he's been a steadfast protector of access to care and of equity. So I don't imagine he's going to change his tune very quickly. So I'd rather have someone like that who speaks clearly. He and I don't always agree, but at least I know where we agree and I know where we disagree. I don't have to ask any questions. And I'd rather move ahead under that situation than with leadership that is simply not prepared and doesn't know where to go.
And I would add, I'm very optimistic. I've known Javier for a long time as well and know he's the real deal. Number one, he's getting criticized for quote unquote not being a health professional or a physician, but no one knows the legislation that our healthcare system is hinged on, the ACA, better than he does. He worked on the writing of that legislation, the support of it. He worked on the litigation to defend it under the attacks from the Trump administration. And as an immigrant himself, and having worked immigration issues as an attorney and then as Attorney General, he is uniquely qualified to have a complete understanding of the comprehensive changes that need to happen in our healthcare system. And then lastly, he's married to a wonderful perinatologist. So if anybody needed a consultant at home, he's got that in Dr. Carol Reyes. So I think he's uniquely qualified to lead our nation at this particular time. And as a non-physician, he's not encumbered by the traditions of physicians, but he clearly understands the issues that will impact a physician's ability to serve communities, especially those that are the most vulnerable.
So I want to talk very quickly with a little bit amount of time that we have left around what I call the dirty little secret. And that is that, again, headline after headline is about health, inequities in the Black and Latino community in LA. We're seeing it again today in the LA Times. Almost on the hour, you see a different headline that now it's being uncovered or discovered that there are inequities in terms of dose distribution. There are inequities in terms of the attention focused on these communities of color. But there's something behind the curtain, and that is that the Black community has been very vocal and very aggressive in terms of getting the attention, getting the resources to those communities. Do you feel that our community is a little bit more, again, humble in its approach, diminutive in its approach, pragmatic in its approach, not as quite as vociferous or as aggressive, I guess, in stating our case, because it seems like there's a little bit of an imbalance in terms of resource deployment, dosage deployment to other communities versus the Latino community. Thoughts on that? Am I off base, or am I hitting on something that is actually factual?
Well, I think we're seeing the symptoms, so we need to understand a little bit further upstream. And there's a historic reason for this because of the fierce, vicious racial segregation following the end of Reconstruction, and the separate but equal rulings from the 1890s. You have the establishment of Black colleges, universities, medical schools, because they would not be allowed to study in the white institutions. So what that did, for the wrong reason, it created a strong institutional base of people that were educated by folks who understood the needs of their community. And in many times, up until recently, in fact, they couldn't operate outside of their community. They were not allowed, so they had to focus on the Black community. That those days now have been done with, but what it did is it left an institutional residue that serves the needs of that community very, very well. Latinos, on the other hand, primarily on the West Coast, didn't get that institutional injection and suffered likewise not being able to get into the healthcare professions or into the institutions. So we don't have yet that institutional base that the Black community got, because it was not allowed. And I cannot say that strongly enough. They were not allowed into the mainstream institutions. So they were forced to do something separate and certainly not equal. So Latinos are just in the process of building our institutions now since the 60s, since the Chicano movement. So our institutions are still relatively young. We will be getting there, but we need to understand that all the communities always need to work together. I do a lot of work with Charles Drew in terms of medical education. It's really clear that we need to work together. And Charles Drew is both a historically Black college and university, and it is also a Hispanic serving institution, very proudly. I think that's the model we need to keep in front of us.
Collaboration is the key. Hector, your perspective?
I agree, Gustavo. And, one of the things we should always recognize is that being Black singles out communities, right? So we see anti-Black racism galvanizing a lot of the discrimination that normally might go to other communities as well. We see that in the Afro-Latin community. In Mexico, growing up in Mexico, the indigenous population was discriminated against, but they were accepted in certain circles and could intermarry, whereas the Afro-Latin population was dealing with the brunt of discrimination based on their color. So that still exists today, and that galvanizes not only active action by the affected community, but also galvanizes support by individuals who want to make a difference for the most oppressed. So we just have to accept that as a reality and recognize that anti-Black racism is a major driver of this. The second thing is, as David said, our institutions are relatively young. We're just building our power base and having the ability to speak out on the issues that affect our community. And in large part because we're not a homogenous community ourselves. We come from different nations: Latin America, Central America, Mexico, and the Caribbean. And that sometimes creates distinctions and firewalls that prevent us from naturally collaborating on this. So that's an important component as well. There's another piece to this, that there's a national narrative that forgets what Dr. Andres Reséndez at UC Davis calls the other slavery, which is the virtual enslavement of indigenous and mestizos in the southwestern United States. But because it was not called slavery, it didn't receive the same attention. But for all intents and purposes, the indentured servitude that was considered to be heritable by children generation after generation was slavery in another name. So that part also needs to be recognized by our policymakers to understand that the vestiges of that other slavery continue to affect certain segments of our population. But the main thing is we're a relatively young population just coming into its own.
Yeah, what's fascinating about this entire conversation, and Dr. Bautista, you may not know this, but one of the founders of the American Medical Association, Dr. Davis, was himself a white supremacist and would not allow Black physicians into the American Medical Association. So the bust and his entire story has been taken out of the AMA headquarters in Chicago. amazingly so, and Hector knows this, we were going through our own reckoning here in LA and discovered that one of our 4 founders, Dr. Joseph P. Whitney, was himself a segregationist and to a certain degree a white supremacist. So we've decided to do the same. In fact, we were a little bit ahead of AMA on this one. The bust of the doctor greets you in the LACMA headquarters. If you come to our headquarters, that's no longer the case. He's now wrapped and we put in storage until further notice. But we're all going through this process of reckoning and understanding and thoughtful discussion. And so any closing comments from Dr. Bautista and Dr. Flores before we close the program? David?
Well, we have seen tremendous demographic changes in this state and in this country. 62% of California, and remember, we're the world's 4th largest economy, if we were a separate economy, but 62% of Californians used to be called minority. We have not yet figured out, as a country, as a society, when we're 62% minority, who are we? Now, you ask the 2/3, we say, hey, we're Americans. That's not a problem for us. So we need to create a new national narrative that is far more inclusive, that includes the experience, the histories of the other 2/3 of the folks. And we need to understand what's our common future? We need to understand then what's our common history in the past, because some folks have been left out, have been canceled out basically of US history. We're there, Latinos from the American Revolution on. We fought in it, we financed it, we helped George Washington win it. But we've all done this together. That should be reflected in our narrative about our past. It'll make it easier for our children to create the narrative for the future of all of us as Americans together.
And I would just add to pay homage to Dr. Hayes Bautista, this conference that he referred to that we co-PI'd in November of 2018 was his vision of what he was noticing in what he calls racially ambiguous babies. 40% of birth mothers are designating multiple races or ethnicities or identities for their child. And that really calls into question the binary system we have today around race and ethnicity. Is going to change dramatically because the future generations of young people are not going to necessarily identify around race or ethnic background, but as something new and something uniquely American. And I think our policy changes will need to follow that. So again, I tip my hat to Dr. Hayes Bautista. He's always 20 years ahead of the rest of us, and that's why I love working with him. Thank you for doing this, Gustavo and LACMA.
No, it's my pleasure to learn so much from the two of you. So I'd like to thank Dr. Hector Flores for hosting the Race Against Zoom call, or Race Against Time Zoom call, earlier today. For all of you who are on that call, thank you again. We'll be in touch with each of you. And I want to thank Dr. David Hayes Bautista on behalf of our entire organization of 7,000 members, our board, and our executive committee. Thank you for everything that you've done, Dr. Hayes Bautista, for multiple generations. I was going to say 40 years. How many years has it been since have you been doing this for 40 or 50 years?
50,
which one is it?
Since 1970.
Oh my goodness. Well, thank you so much for your work and the impact you've made. Your insights, your thoughtfulness, and your approach are changing mythical stereotypes as the Latinx population continues to impact American society. Many thanks to our sponsor, the Patient Care Foundation, for their generosity, and our production team of Gabe Zuniga and Dennis Chung. Thanks again for listening to Clear as Mud. Be safe, be healthy, be well. Thank you again, both of you. Thank you.
Thank you for the
invitation. Thank you, David.
Thank you, Hector.